Hello, I'm Dr. Robert Bonakdar, and it's a pleasure for me to be here today to share with you some information on metabolic shifting and immune resilience. This is a very important topic as we are dealing with the COVID pandemic, and one that I've been extremely interested in, especially with all the news reports of what we have been hearing about what can, what cannot, and in many cases, what we don't know can really help our immune system. So, with that, we have our faculty disclosures as well as our learning objectives, which include discussing the role of dietary patterns such as low glycemic and Mediterranean diets in modulating the immune system, recognizing the role of dietary timing and other dietary strategies in modulating the immune system, and finally examining evidence for micro and macronutrients in approaching ways to more easily approach supporting our immune system. As I was mentioning, there has been a lot of information, a lot of misinformation on what can and cannot affect our immune system in a positive way. There's a lot of desperation, there's a lot of confusion, and in many cases, some fraudulent products as well that can make this entire discussion very difficult. So one of the things that I wanted to look at is not only what we did not know about immune support and what might still be questioned, but what we really do know. And I chose to focus on COVID-19, the pandemic, specifically because it is on everyone's minds and it is a great model for looking at how the immune system, in many cases, is affected by many of the same positive nutritional choices that we've always made and we've always endorsed. In this respect, that's a great foundational place to start. So the mechanisms that we know that may serve as a model of how dietary strategies may promote immune resilience look at specific mechanisms having to do with the cytokine storm, the inflammasome activation, and endothelial dysfunction. There are a number of mitigating factors which we're going to look at specifically that may be influenced by diet. These are TMAO, meal timing, glycemic spikes, toxins, sodium intake, and nutrient deficiency. So we're going to try to cover these as approaches that we can discuss with our clients when we're talking about how nutrition can affect immune resilience. So COVID-19 is a model of immune decompensation. What do we really know about what happens in a dysfunctional manner when COVID-19 takes hold? Well, we do know that in many cases there is some type of a cytokine storm. It's a term that many of us have heard. What it really is looking at is a multi-level inflammatory response that's heavily influenced by the cytokines, as well as things like interleukin-6, which is one of the example molecules that I'm going to be referring to in a number of the graphics that we are going to be looking at today. But in addition to that, there's a number of other inflammatory factors which are working at multiple areas of the cell, which can also increase the complications of COVID-19. Secondarily, but connected, is the concept of the inflammasome. Think of the inflammasome as a surveillance system. Whenever there's a disruption, this could be a pathogen, it could be an allergen, it could be other issues that put the system off. And in those cases, the inflammasome is assembled. So it's a multi-cellular system that tries to respond to inflammation. The response may be the cytokine storm, but the inflammasome in and of itself is another important aspect that we need to keep in mind that may increase the inflammation picture. How it does so here as the inflammasome is getting assembled is by extending the inflammatory picture to multiple aspects of the system. It could be the pulmonary system, it could be the vascular system, and those are the two areas where we most typically have significant inflammation that may have systemic effects and may in fact have issues with morbidity and mortality. Again, we see interleukin-6 as one of the molecules that's part of the cytokine storm. The third important model that we're hearing more and more about is endothelial dysfunction. Now, endothelial dysfunction or endothelial disease is not something that is new to anyone in the audience. It's something that we've talked about as an aspect of preventing cardiovascular disease, using proper diet, nutrition to prevent endothelial disease with the hopes that may go on to reduce chances of heart disease, stroke, etc. But what's very interesting is that a number of research articles looking specifically at COVID, especially the long-term impact of COVID, is that it may actually be a endothelial disease. Although we often think about it as an issue with respiratory disease, because the endothelium is throughout the body, is actually something, a model that makes a lot of sense when we're looking at complications of COVID-19. This is an article that was a collaborative effort, including from Harvard and international researchers, that basically talked about COVID-19, the end game of COVID-19 being endothelial dysfunction and the cytokine storm. So again, we see these concepts of the inflammasome, endothelial disease, and cytokine storm coming together. For those who are not quite as familiar, just think of the endothelium as the very inner lining of the blood vessel that in many cases has is very sensitive to changes in inflammation. And in those cases can have significant swelling and dysfunction when the body's trying to deal with inflammation. When we look at these research articles, one of the areas that I always have issues with the response is typically that they're looking for the most powerful response that may be an external response. And those may be appropriate in some cases, especially in severe disease, life or death situations, which often we are in, unfortunately. And those may demand antiviral therapies or other therapies that may support the endothelium, as we've seen in multiple articles and well-publicized cases of patients with COVID. And there's a number of pharmaceutical agents. But one of the things that I always like to do in these scenarios is look at, what are we able to do in a nutritional model to do some of the same things that we're looking at emerging pharmaceuticals in supporting recovery. So a more rational approach, I would say, is a more rational starting point is to fully acknowledge the importance of all the factors that we've talked about, the models of the cytokine storm, endothelial dysfunction, the inflammasome, et cetera, but look at really how lifestyle factors, including inactivity, improper nutrition, issues with poor sleep and stress management, may actually contribute to the cytokine storm, the interleukin increase, et cetera. And how can we use that knowledge to counsel our patients effectively? And in many cases, what we do find is that fortunately there's a number of great review articles, several of which I've referenced here today, which talk about how nutrition is a foundational approach to the COVID pandemic, and I would say, arguably, to immune resiliency, which is the point of this discussion. Although we are obviously have all our attention on COVID-19, many of the same things we're looking at can be important for many of the pathogens and immune factors that were affecting our patient population that will continue to be an issue far beyond COVID-19. Articles that do a good job in this scenario look at what the individual needs to do, as well as how those choices need to be scaled to help our community, our nation, and global efforts. Just as an example, there's some very important foundational discussions of nutritional approaches at the top, as well as, I think, very important, how do we bring this to populations which may not have access to all the nutritional approaches that we're recommending, and how do we get them those foundational approaches? So we'll come back to this. Another great review article looks at dietary recommendations from different international organizations. Many of these recommendations say some of the same things we just reviewed in the previous article, looking at a good nutritional intake of antioxidants, as well as fortification in specific cases as appropriate. There are a number of discussions in these recommendations talking about how dietary approaches connect well with potential use of supplements, as well as proper lifestyle choices, which is always important to keep those in perspective. So based on what contributes to COVID-19, what markers and nutritional factors should be considered? And I think it's very important that when we're talking to patients who are often familiar with markers, whether we're talking about inflammatory markers, vitals, um, looking at lipid markers, glycemic markers. Are there similar markers that can be used potentially when we're looking at immune resilience, especially how it is affected by nutrition? Um, so as we go through this process, I'm going to be talking a little bit about uh, markers such as TMAO, as well as other mitigating factors that they then may inform how we can mitigate some of the big models, dysfunctional models of how uh, immune resilience can be undermined. So as far as a marker, I've been very intrigued with TMO, trimethylamine and oxide, which instigates an inflammatory response, which is discussed in a number of papers that look at the same inflammatory arenas that we've talked about, the inflammasome, cytokine storm, and endothelial dysfunction. Very interestingly, it has recently, just within this month, been discussed as an issue within the realm of COVID-19. And I think we're going to hear more about that. Why you're going to hear more about that is the fact that TMO is one of those bridge markers or molecules that may allow us to connect what's happening in the gut, typically what's going poorly in the gut as far as dysbiosis and products, inflammatory products that are being made in the gut that then leave the gut and cause collateral damage in the endothelium or elsewhere. So TMO is one of those molecules that's being looked at. It was isolated at the Cleveland Clinic, and it is available as a marker that typically cardiologists are looking at because it does have an increase in association with cardiovascular disease, as well as cognitive dysfunction and some pulmonary and respiratory issues, which is very interesting to consider when we're talking about COVID-19. So TMO appears to be influenced both by dietary measures as well as processes in the gut that convert factors into TMAO. So there's multiple issues, but definitely there's a dietary issue. And from there, through processing, it can end up affecting the inflammatory process in the endothelium, as well as other areas to cause both an inflammatory hyperresponse as well as endothelial dysfunction. So in the model of COVID-19 and immune dysfunction, it does make sense to be looking at TMO. We also realize that there's a number of factors, especially in the Western diet, that can influence it. We know that the Western diet, especially with refined carbs, unhealthy oils, can increase TMAO production by 3 to 10-fold, as well as decrease some of the other factors, such as the short-chain fatty acids, which may help mitigate the levels of TMAO. So focusing first on the left side here, the things that we do know from research thus far in general that do increase TMO are animal products, high intake of these products, not occasional, but definitely consistent daily or at least multiple times per week of animal products, as well as a high-fat diet that's not tempered with other aspects in the diet, typically like fiber, lifestyle issues like sleep deprivation, exposure to toxins and pollutants, and some level of vitamin deficiency. We'll talk about some of the factors that will reduce TMO shortly, but let's focus on what increases it now. So in addition to high intake of animal products, we do know that fat, especially high fat, this was a study looking at a 63-gram load of fat meal, had a significant immediate ability to increase TMO. And TMO has been looked at in various studies and sometimes is not that easy to reduce or increase, but high fat meals tend to be, again, unmitigated, tend to be one of the factors that does increase it immediately. We also know that it's linked to, as we'll talk about later on in the presentation, vitamin deficiency, and that TMO is associated with it. We don't know exactly the causative factor here, and it's probably more complex than a direct causation. As well, so in addition to what causes an increase in TMO, it's important to look at what our clients can do to mitigate that. There are a number of things, including a anti-inflammatory vegetarian, vegan, or Mediterranean type diet, especially those that have high fiber intake, high nut intake, some level of pre and probiotics. Resveratrol has been shown to help reduce this, and DMB, which is a factor in olive oil, wine, and balsamic vinegar. Again, you're seeing a number of factors which are typically associated with the Mediterranean diet, as well as being nutrient replete. So just focusing on the first item in general, as far as a dietary pattern, we don't often think of the Mediterranean diet as a factor that can affect the immune system. We look at it in a number of studies, large-scale studies, looking at how it can reduce cardiac morbidity and mortality. But the fact is that multiple research studies have looked at the fact that it can mitigate a number of the inflammatory markers. Here we can see both short-term Mediterranean diet with or without additional extra virgin olive oil, nuts, as well as long-term compared to other diets, can have a significant reduction in some of the inflammatory factors that are involved with the cytokine storm. So it makes sense that it can do that. In addition to that, there's a number of other factors that I think are important to keep in mind. Some of these we've talked about, but I'd like to go through a few more on the right side here. Intermittent fasting is very interesting. It's something that almost all of our clients have discussed with us in one way or another. It's something we've read about. So it's an emerging area that's exciting. There's obviously some caveats of who it may work with the best and who may not be a good candidate. But one of the interesting things about it is that we do know that it may have an immediate effect on the immune system. And some of the research that's come out was reviewed in this New England Journal of Medicine article, which I've cited here. There is also a more recent article this year which looked at fasting as an approach for improving endothelial dysfunction. This was a small pilot study, I believe 13 subjects, but the vast majority, especially those who had very high levels of TMO, were able to reduce them, but in some cases not across the board. So we do need additional studies here, but this is one of the first proof of concept looking at TMO being improved with fasting, among other factors, including leptin levels, as well as glycemic status. When I talk to clients about this, obviously there's a number of ways to do this. There's a number of articles which look at a 18-hour fast, which is sort of at the more advanced end. I just simply tell patients, the average American eats about 15 hours a day. If we can begin to curve that back, maybe on one end first, meaning eating a little later in the morning, eating a little bit earlier, late in the day, so that the hours of feeding can get closer to 12 hours. And that in and of itself has had some benefit in a number of studies, especially looking at cancer prevention. And then maybe looking at the other end of the feeding. If they started with later breakfast, then maybe there's ways that they can mitigate. They can work on eating their last meal earlier in the day, and then maybe doing this on an alternate fashion until their body becomes more tolerant of it. Some people do very well with this. Their bodies are primed for this. Others have a difficult time, but letting them know that it's a slow process. Not everyone has to get to a 6-hour feeding window, but let's try it. Let's monitor it and look at the factors, including TMO, some of the glycemic factors, etc., cardiovascular factors that may also be changed with this. Blood sugar is also an important factor. We do know that even in non-diabetics, there can be significant glycemic excursions, which are important to keep in mind, because we know these excursions can have effects not only in going on to prediabetes or diabetic state, but they can have a significant impairment on the immune system, as well as endothelial dysfunction, and in some cases setting in an inflammatory response. And especially if these become not only an irregular exception, but if they become more regular. What is interesting is that a lot of patients aren't aware of these glycemic excursions because they often just get a quarterly blood test, which may show your blood sugars are in the fasting or in the normal zone when you're fasting, or they may get a hemoglobin A1C that's not significantly elevated. So it may be not an area that they are looking at on their radar. But when patients have a strong family history, or there's something that's maybe borderline, we do try to use wireless blood sugar monitors, which are now becoming more prevalent and cost effective. We also talk with our dietary professionals how to help clients use proper measures when they're eating, so they're not getting a unobstructed carb load, especially if they do have some signals of difficulty with tolerating that. And this can be very personalized. Some people tend to spike with different foods, so it's important to monitor if there is concern. We also talk about some simple measures with avoiding dietary toxins, preservatives, additives as much as possible. So simple things like trying to avoid artificial sweeteners, cooking in a way that reduces advanced glycation products. And these can be very simple. This is an article that's somewhat older, but it just talks about some very practical ways of how to cook, looking at the heat of the cooking, the timing of the cooking, as well as how to mitigate some of the AGEs with using simple ingredients that are acidic in nature. Always try to mention good food choices, especially with fruits and vegetables, which might have higher propensity in some cases of pesticides. So working with research like the Environmental Working Group so that patients are aware of their risk. We try to talk about simple things which may be forgotten about when we're talking about immune resilience, which include trying to avoid high salt foods, excessive salt, especially foods eaten outside the home, which can have added salt, which can have a significant effect, especially causing a glucocorticoid response, which can then affect our immune system as you would imagine. This is a great review article from Hypertension, 2018, which goes through a number of the steps, including the interleukin increases here on the right, as well as the high salt load and how it can affect endothelial dysfunction, again, showing that many of these factors are highly interwoven. The last piece of this is really nutrient adequacy. We talk a lot about, and there's been a lot in the press about how nutritional deficiency may be affected. I would say a lot of those studies are still preliminary. We see a lot talking about zinc and vitamin D, and definitely there are signals that patients who are frankly deficient in vitamin D appear to be more likely to contract COVID-19 in some studies, almost twice the rate in subjects that were vitamin D deficient. There's also some preliminary evidence to show that vitamin deficiency not only increases chance of having COVID-19 if there's exposure, but also increasing the rate of complications. There's been some controversy here, but it is something that's getting some press, and I think we're going to hear more about that. There's also been some interventional trials. There's over 30 studies on clinicaltrials.gov just on vitamin D. There's been some interventions looking at high-dose vitamin D. Those have not significantly had an impact. However, it appears to be something important to look at prior to the onset of the condition. So doing our best to talk to patients about reducing the chances of deficiency before there might be exposure. Zinc is another important nutrient. This is a recent study that just came out that looked at patients with low zinc levels in comparison to healthy subjects had increased complications related to COVID-19 as well as prolonged hospital stays. When we're talking about any of these nutrients, we always try to start with diet before we talk about supplementation, because it puts a good focus on how healthy the diet is, especially with a high amount of stress and change in habits. The dietary routine can be way off, and it can be more sort of convenience meals. So I always like to use these press releases if they come in, the patient is asking about vitamin D or zinc. Let's talk about diet. What is your intake of green leafy vegetables? What is your intake of foods that may be high in zinc or magnesium? And that can always be a good foundational step. I usually turn to resources such as the Linus Pauling Institute. They have great resources on things like endothelial dysfunction. You can click on various nutrients and get a nice handout. You can also go to a page they have, which is looking at immune system support. What I like about this is they have a PDF with about a dozen different nutrients, as well as how to get them through dietary intake, as well as if you are going to supplement, how to take it, what are sort of the maximum limits. As we know, some of these, when they take too much for too long, can have secondary issues, maybe depleting other nutrients. And they have specific sheets on the nutrients like zinc, magnesium, to also allow you to provide those as handouts if you'd like. When I have this discussion with patients, I think there's many approaches that work. Obviously, we've talked about foundational nutritional steps. We've talked about when folks talk about COVID-19, many of the same factors that we are trying to improve with cardiovascular disease, endothelial dysfunction, reducing inflammation, are many times the same things we're trying to do when we're preventing folks from having increased chances of having an immune exposure or episode where they actually come down with an immune system dysfunction. All that being said, and as far as nutrition being a foundational piece of that, I always like to talk to patients about what else are we doing, especially at times of significant stress from multiple avenues. So we try to talk about sleep, stress, activity, and how's your environment. We do know that sleep can be an incredibly important factor, even if you're having a wonderful dietary background and intervention. We know that sleep can be significantly affected by everything that's going on. That can affect the gut, in many cases promoting dysbiosis. We also know that poor sleep can indirectly affect our appetite, what foods we choose, how much we intake those foods, which can also impact, obviously, many of the factors like our glycemic load, inflammatory issues, etc. So those are important to keep in mind with sleep. Finding ways to manage stress, such as meditation, mindfulness, and obviously enjoyable activity. These can all be part of the big picture on supporting the gut, which can go on to support the immune system. So in summary, we know some of the big factors: the cytokine storm, the inflammasome issues, the endothelial dysfunction, as well as more specifically TMAO and dysbiosis, which can all be part of that vicious cycle. We know the diet is truly important, as is an inflammatory and anti-inflammatory makeup of that diet, consuming it in a mindful, low toxin manner, and making sure that we are nutritionally replete, and in certain cases, utilize supplementation as needed and appropriate. And always putting this with the caveat that how's your sleep, how's your stress management level, and how's your overall lifestyle as well, in trying to come to terms with everything we can do from nutrition and beyond to help with immune resilience. So as we finish here, I hope this presentation has helped create a comprehensive plan for utilizing nutrition and some of the resources that are provided, how to recommend dietary patterns, including Mediterranean and other anti-inflammatory patterns for immune resilience, and finally, how to provide guidance that's pertinent and reasonable for patients to begin today to help them with immune resilience. It's been a pleasure being here with you today, and I look forward to any questions you may have.